talk about glaucoma. So, glaucoma is one of the two most common eye conditions that we're going to be discussing. It's either glaucoma or cataracts. Let's focus on glaucoma. This is increased intraocular pressure. You have too much fluid within the eyeball chamber. And the eyeball kind of looks like this. More or less, it kind of looks like this, all right? So you have an anterior chamber, a little too big right here. So you have an anterior chamber and you have a lot of fluid in here. It's called the aqueous humor or the aqueous humor, however you want to pronounce it. And normally that fluid circulates. It goes this way. You have specialized cells within the chamber that produce the fluid, okay? It's called the aqueous or the aqueous humor. And so that fluid normally escapes out through a smooth muscle that you find inside the eyeball called the ciliary body. It goes through something called the canal of Schlemm. We'll be talking about this more today. My point is this, guys. What's supposed to happen is that fluid's supposed to continuously circulate this way, and then it comes back in through the pupil, the gap of the eye, and it just continuously does this, and that maintains pressure. You also have fluid that's more like gelatinous back here called the vitreous or the vitreous humor. So that's what's supposed to happen. In glaucoma, that fluid cannot escape. Something happens to that ciliary body and it becomes obstructed and that fluid cannot get out and you only have fluid coming in. So you have a lot of fluid in the anterior chamber and that places pressure on the most critical components of the eye, which is going to be the posterior part known as the retina. And the retina is the nerve part that conducts photoreception, meaning light reception, into what we call the optic nerve. So again, in glaucoma you have way too much fluid inside the eyeball. You have two types. You have angle closure, and you have open angle glaucoma. I need you guys to associate the first basic elements. Angle closure is acute. It happens suddenly. That pressure builds up really fast. It causes a lot of pain, a lot of visual issues, balance issues. And then you have open angle. This is more chronic. Okay? Open angle, angle closure. Acute, chronic. You guys have to know that first. And so let's talk about angle closure real quick, or open angle glaucoma. This happens as that little canal of Schlemm that I talked about, it limits the fluid passage, but little by little. This develops throughout the years, and the main thing that it destroys is your peripheral vision. The only problem is when somebody has glaucoma, when they have open angle, chronic glaucoma, is that they don't notice that the peripheral vision is being lost right away. They don't notice it until a significant percentage has been destroyed and they have like tunnel vision. And that's when they start reporting, hey, you know what, I can't see the sides a lot. That's glaucoma. The problem is whatever vision loss has occurred, it's permanent. Make sense? That's your open angle. You lose your peripheral vision, it happens little by little, and the destruction that occurs is permanent. You can't get it back. And then you have angle closure. Okay? This is acute. This develops suddenly. Okay? This develops suddenly. It causes a lot of severe pain. It causes nausea, vomiting. The patient can't even really move around a lot because you know vision is paired up with your ability to move around. And so it causes the patient to feel sick. That's your angle closure glaucoma. It happens right away. Does that make sense, guys? Okay. When we talk about glaucoma, you need to know ways to reduce IOP. So when we talked about ICP, intracranial pressure, the same teachings that you give that patient, like no bending over, no coughing, keep the head of the bed elevated, same thing for people with glaucoma. and then you still give them mannitol because it's in the cephalic region. That's where that diuretic exerts its effect, not the cephalic region, but the tubules where that fluid is reserved for the cephalic region. So that's what you want to do with these patients. These patients will also be receiving the medications. They give beta blockers. They give specific type of beta blockers that relax that smooth muscle to allow the fluid to escape. Does that make sense, guys? So whatever damage that they've had, whatever vision loss that they've had, it's permanent, and they lose their peripheral vision. Does that make sense for us?
Do they lose vision in angle closure?
In both. But this one, since it happens really fast, you have to, they don't start losing their vision like that second. It can take a few hours. So the goal, it's a medical emergency. You have to get them to the doctor, reduce that IOP and more, otherwise that's correct. If damage does occur, it's permanent. What was your question?
Also, the angle closure acute might not be permanent, but the open angle is permanent.
Well, let me offer you this explanation instead. No, hold on, relax. This one happens, hold on. This one happens really fast, right?
Yeah.
Now, how long does it take for the nerves to die off? It takes a little while. It can take a couple of hours. So if there is some type of loss of vision, it is permanent. But if we can address the issue before you develop any permanent vision loss, then you don't develop any. Odds are you're going to have some though. Now, open angle glaucoma is more known for having vision loss because it happens little by little. So, what was the last time you guys checked out your peripheral vision? I do it all the time because I get paranoid. But if I'm looking forward, right here is where this is where my peripheral vision reaches, right here. So, if you're not constantly checking that, oh, you have to look straight. You have to look straight. Where do you see? I can see mine right here. There you go. So, these patients won't notice it until a significant amount of their peripheral vision is gone. That's the issue with open angle glaucoma, with chronic, because you don't know until a specific percentage is gone, and by then that vision loss, it's permanently gone. The patient will tell you they have tunnel vision. A couple of more points. If you have the eyeball, okay, this right here is the pupil, this right here is the iris, the colored part of the eye, okay? The goal is to keep that pupil open. Because, I'm sorry, say that again. The goal is to prevent that pupil from opening. So you want to promote something called miotic behavior, meaning that the pupils will constrict. That's what you want. You want them to constrict. You're going to avoid giving mydriatics, which are pupil dilation medications. So you want to keep them constricted, you want to prevent getting them dilated, because if the pupil dilates, what it's doing is putting more pressure within the eyeball, and it's going to increase IOP. Make sense?
So miotic is opening of the...
Miotic is constricting, mydriasis is dilation. So you want to avoid pupil dilation, you want to promote pupil constriction. And different eye drops produce both of those effects. So you want to give miotics as opposed to mydriatics. Okay? And in a nutshell, that's what you guys pretty much need to know about glaucoma. There's two different types. So in this question, a nurse is reinforcing teaching with a client who has a new diagnosis of primary open angle glaucoma. Which of the following pieces of information should the nurse include in the teaching? Lost vision can improve. D says driving can be dangerous due to the loss of peripheral vision. Laser surgery can help reestablish the flow of aqueous humor. So remember how I told you that fluid gets trapped? That E is saying that. E is saying that surgery. What does it say? What type of surgery? Laser surgery can reestablish that flow. That's what it said.
So it can?
Well, that's what we're trying to find out. So with the information that I gave you guys, can we come up with an answer? Lost vision can improve with eye drops.
No.
Administer eye drops as needed for vision loss.
No.
Okay. Glasses will be necessary to correct the accompanying presbyopia. You guys know what presbyopia is?
No.
No.
It's age-related vision loss. It's age-related vision loss. Driving can be dangerous due to the loss of peripheral vision. And then last is laser surgery can help reestablish the flow of aqueous humor. We have something called phototherapy that's essentially using, sometimes they use lasers or heat, and so we'll see right now. So is A part of the answer?
D. D.
D. What else? Or is that it? C. What else? E. Okay.
But it can be started. Just see the
Okay. So let's just go to the answer because we'll be clicking on this ever. So driving can be dangerous, and laser surgery can help reestablish flow. Lost vision can improve with eye drops? No. Whatever vision is lost is gone forever. So it's not in. That's good. Administer eye drops as needed for vision loss. Again, whatever loss of vision occurred, it's permanent. Glasses will be necessary to correct the accompanying presbyopia. Those are two separate things. Presbyopia is age-related vision loss. So it's not like it's accompanying, right? And so it says, damage to the optic nerve that occurs secondary to increased IOP causes a decrease in peripheral vision and can cause complete vision loss if not treated. Laser surgery can reopen the trabecular meshwork and widen the canal of Schlemm. That's that tube that the fluid's supposed to pass on through. And mind you, we'll be talking about phototherapy, that's what it is, or photocoagulation. It's where they put a little beam of light that heats up a specific part of the eye and it softens it up, and that's how we can actually manipulate it, by softening, contracting it, and that's how it can reestablish flow. That's correct. So eye drops will not improve. We got that. The client should administer eye drops on a regular schedule to reduce intraocular pressure, not the vision loss. So the medications, the drops that we give, what do you think they're going to do? Are they going to constrict or are they going to dilate?
The eye drops?
Yeah.
I didn't know eye drops could work like that.
I just told you guys that. Medications, the eye drops can either constrict. When you guys go to like eye exams, they put little eye drops and then your pupil gets dilated so they can see inside and do whatever they have to do, like LASIK surgery, stuff like that, or just an eye exam. And they can give you medications that constrict as well. So for this medication, for this patient, those are the type of eye drops, miotics, because you want to keep the pupils constricted as opposed to dilated. And then it says damage to the optic nerve. Okay, we talked about that. Eye drops will not improve vision. However, they can reduce IOP, and that's by constricting the pupils. The client should administer eye drops on a regular. We talked about that. Presbyopia, which is a decrease in near. I'm sorry. What did I say? Vision loss or hear loss? What did I say? Good. So presbyopia is a decrease in near vision that occurs after 40 years of age. Is not related to a primary open-angle glaucoma. Vision loss that occurs with this will not improve with glasses. Any questions, ladies? No? All right, cool. So